Hello, everyone, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a quick few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. Before we introduce our speaker, I'd like to briefly go over what you're seeing on your screen. Think of this as your homepage for this session's Learning Collaborative. You can resize or minimize any of these modules as you see fit by clicking and dragging them around your screen. The screen in the middle is the media player where you will be able to view the presentation. If you're viewing on demand, you'll be able to pause and skip forward and back to review specific moments of the presentation. On the left, you'll be able to learn more about our subject matter experts and also access resources key to this collaborative's learning goals. On the right side is our discussion board, where we will post regular discussion questions so you can engage with our peers and our subject matter experts asynchronously after the event has ended and until the collaborative wraps up on week 8. There is a brief survey available for you to complete at any time. We take your feedback seriously as we continue to improve our program for you. Please fill out by the time the collaborative ends. And finally, you can follow this link to learn more about our past and future learning collaboratives, which are available for you to access at your convenience. I'd like to now introduce today's speaker, Dr. Carolyn Francavilla. I'd like to pass it on for her to do a brief intro and start her presentation.
Well, hello, and thank you. And thank you for putting this on. I know this is really valuable information for our private practices. So I'm Carolyn Francavilla. I'm a family physician and obesity medicine specialist in the Denver, Colorado area, and my practice is Green Mountain Partners for Health. I'm also the current chair for the AMA's private practice physician section. And I'm really excited to talk with you about virtual assistants, which are something that have really helped transform my practice over the last few years. We are going to start off going through some of the basics of virtual assistants. And then at the end, we will talk about my experience with virtual assistants so you can see what it looks like to implement it and what a success story with virtual assistants look like. So first, let's start with the very basics of what is a virtual assistant. Simply put, a virtual assistant is a remote independent contractor. And your virtual assistant might be working somewhere in the United States, might be working in your state, might be working down the street from you, but they also may be working remotely from another country on the other side of the world. And virtual assistants can really do a large amount of different tasks for your clinic, which is something we're going to explore today. But really anything that can be done remotely that doesn't need to be done face to face, doesn't maybe need to be done in real time, doesn't need to be done directly for a patient, is something that could be done by a virtual assistant. So, in my clinic, I haven't figured out how to do an EKG remotely, but there are very many tasks that we have been able to transfer to our virtual assistants. Sometimes AI is included in this concept of virtual assistants, but that is not a topic that I'm going to be covering in this presentation. So why are virtual assistants rising in popularity? Why are they something we should consider? I think there's two very large driving factors that have convinced a lot of private practices this is something they need to explore. And the first is rising practice costs, which post-COVID have included many different issues. And then the decreased labor force in most of our communities, it has been harder and harder to find employees post-COVID. And that has been a real challenge to being able to serve our patients. But beyond the sort of basic logistics of why you might be thinking about a virtual assistant, there are some really big positives that your practice may get. You can remove a lot of administrative burden that may be very stressful to the physicians at the practice, maybe adding a lot of job stress and dissatisfaction to your in-person employees. Virtual assistants can dramatically improve efficiency. They can really help with patient access and getting more services to your patients. They can reduce your office space needs. When you have someone working remotely, whether they are in the same community as you or across the world, they are not using valuable real estate in your clinic that may be something you can generate more revenue from. They're going to decrease overhead in most cases. And they can also, on the flip side, and this is part of the story I'll share with you later, allow you to increase pay, increase benefits, increase satisfaction for your in-person employees, and help you retain those in-person employees as well. So where do you find a virtual assistant? This is probably the most common question I get. And there's really two main directions you can go here. The first is to recruit and find a virtual assistant yourself. Now, this could be done in a variety of ways. There are online platforms where you can find people. You may find them within your community. Again, a virtual assistant doesn't always have to be, in a different community or a different country. And reasons to find your own virtual assistant might be that it's more affordable. You're not paying for any middleman or administrative or finder's fees or anything like that. But it also may take more time. And if you have not hired a virtual assistant in the past, you may not really know what you're looking for or how to interview someone that's in a little bit of a different setting. So another option is that there are many companies, and these seem to be growing by the day right now, that will help recruit and train virtual assistants for you. And so a reason why a lot of people will start here is that this is often a quicker process. Usually they already have virtual assistants that have been hired and vetted and are ready to go. This may make you feel a little more comfortable with different legal or privacy concerns because many of these companies will offer a BAA. And so you'll have some business agreement with them in terms of that relationship. And so they are having some additional responsibility. They often will already have done essential training for your virtual assistant, things like HIPAA, basics of how the US healthcare system works, explain how EHRs work. And then a lot of times it takes the payment out. You pay the company for the contracting with the virtual assistant, and you don't have to pay the VA directly. The flip side is that it's probably going to be a larger investment if you use one of these companies as opposed to finding the virtual assistant yourself. So how do you use a virtual assistant? This is definitely the other common question I get, like, well, but what do you have them do? And so this involves a little bit of evaluating what your clinical needs are, but some ideas to kind of think about is really anything that doesn't need to be done in person is something that a virtual assistant can do. So scheduling is definitely a really common thing that you might use. Surgery scheduling, using your VA to help with reminder calls. They might answer the phone for you. Maybe they help scribe. Actually, this is one of the original uses for virtual assistants is to have someone on the computer with you scribing the note for you, maybe even taking care of referrals or lab orders or other tasks that need to be done while you're in real time with the patient. They can do tasks in real time, even if they're not scribing. So it's not uncommon for me when I'm with a patient to just say, oh, just hold on a second. Let me send a message to my virtual assistant and see if they can take care of this for us. And so sometimes they're able to call a pharmacy, help with a referral issue, all sorts of things that by the time I'm done with the patient visit, the virtual assistant already was able to get me an answer for the problem that the patient had. They certainly can be very helpful with prior authorizations and pre-certifications. As we know, we would like for those to be easier to do and possibly just go away. But the reality is they are a very big burden to both our patients and our clinics right now. And so that's one of the most high value things we have gotten out of our virtual assistants is to train them in how to complete these prior authorizations to really help our patients get the medications they need. Sorting faxes. In primary care, we get a lot of input into our EHR. We have 5 different clinicians that fax or prescription refill, the note from the hospital, the note from the specialist needs to go to. And so our virtual assistants take all of that input that comes electronically and sort it to the right clinician. Medical records, sending those out from our clinic, requesting them, another helpful use of our virtual assistants. You might use them for triaging in your clinic. You could use them for billing, coding, and often can be very skilled in that. Remote patient monitoring, if that's something that you're using to engage patients or to generate additional revenue, your virtual assistant may be the right person to do that chronic care management or remote patient monitoring. Data entry of all different sorts. You use them for inventory or supply monitoring, language support, translation, are all just scratching the surface of different ways you can use a virtual assistant. And so what I would recommend if you're considering this is to take some time to write down all the tasks that need to be completed in your clinic, all the different job duties, and then sort them, circle them, however your brain works, into what tasks truly don't need to be done in the office and may be appropriate for a virtual assistant. So, how do you train this virtual assistant? You may find that you have someone who actually comes in with a fair amount of training. If you are using one of the many companies out here who can help you recruit a VA, again, they may have done a lot of essential training on the basics of what their job is going to be. Likewise, if you recruit a VA yourself, you may find someone who already has worked in a clinical setting similar to yours. Maybe they worked for an insurance company. They may have worked for a billing company before. So they may have all the skills coming in and just need to learn the particulars of your clinic, your style, your EHR, and some real specific things to your area. But essentially, I would start with who normally trains your employee. Do you have an office manager? Do MAs usually train the MAs? Do you have an employee handbook? Do you have a policies and procedure handbook? You're going to start in those same places. If you have training videos that maybe you use for OSHA or HIPAA or anything like that, you can use those for your virtual assistants. You may have them shadow you, right? You may have them come through Zoom or whatever platform you like to use so they can see how you practice, or shadow your employees and see how your employees practice. Of course, you'd want to make sure patients are aware that this is happening, and have already done your HIPAA training, but shadowing is going to let them see what your clinic really operates like. And just like you would likely do with any employee, you're going to want to have meetings for feedback. So, depending on who that is in your practice, whether that's like a lead medical assistant, your office manager, or maybe you, consistently meeting and giving feedback just like you would for any other trainee. Another topic that you might consider is how to monitor the work from your virtual assistant. Certainly, when you have someone in office, it's a lot easier to have a sense of if they're completing tasks, if they're showing up on time, if they're taking their breaks appropriately, and if they're just doing their job. But with a virtual assistant, some people are worried that the virtual assistant may not be working as much or being as productive as they would like. And so there are apps and different computer systems out there where you can monitor your remote workers if that is something that is important to you. You probably want them to have a supervisor or a manager that they report to who can make sure that they are available throughout the day and that they are completing the tasks. And if you're a small practice, that might be you. My style has been to be a little more focused on our tasks getting done, are the assigned workload being completed, and can I reach this virtual assistant when I need or when I expect them to be available? And in my clinic, that has worked fine. We have not had to use any sort of monitoring systems, but those do exist if that is something that you think you need in your clinic, or maybe if your clinic is really large and it's hard to keep track of what each individual virtual assistant is doing. But our VAs are incredibly responsive. Like I said, I'll often send them a message while I'm with a patient and they have addressed that issue before the encounter is even over. So some special considerations is, you know, we want to make sure we're taking care of our employees, and there can be some interesting issues that come up, especially when we are working with overseas virtual assistants. So obviously there is going to be a difference in the shifts that we are working and what is sort of normal daylight hours. So you are going to want to ask yourself, what hours do you want your employee to work? They may be working in the middle of the night if they're during your office hours. That may be what your office needs, and that may be what the employee needs, right? That may work for their lifestyle. That might be why they're looking for a virtual assistant job. But I think that's something to explore and, make sure that we are doing what makes sense for our employees as well as our practice. And we do have to balance that. For some virtual assistants, the time they work may not be important. One of our virtual assistant tasks is predominantly billing related. And so for that particular virtual assistant, whatever hours she needs to get the job done are the working hours that make sense. For our virtual assistants that offer us a little bit more support with patient care, we do need them available during working hours. Another thing to consider is appropriate pay. And so this information is widely available on the internet, but you want to make sure that you're paying someone an appropriate living wage or, hopefully beyond that, wherever they're at. And so there certainly are people who will use virtual assistants in other states where cost of living might be less. I'm in a fairly high cost of living area of the country. And so, I might be able to get a virtual assistant who's elsewhere in the US and may have different expectations of appropriate, wages. I may also be able to hire a virtual assistant that's overseas, which often is much lower cost per hour than what I would be paying someone in the US. But again, you want to kind of Google what's the appropriate rate, what's normal salary in, say, the Philippines, which is a common place people hire virtual assistants for, and make sure again that you are compensating your employees appropriately. And if you are using one of these companies that outsources virtual assistants, you want to make sure they're treating the employee right. So making sure they're actually paying the employee, paying them what you have agreed on, what the rate the employee is getting, because of course these middlemen will sometimes take a fair amount of that money that you're paying them. So just things to explore and be aware of when you are hiring virtual assistants. The other big thing that can be a really big positive is how is this going to change your role for in-person employees? So when we were evaluating how we were going to change staffing in our clinic, we were getting feedback from a lot of our medical assistants and receptionist sort of staff that they felt they had a lot of really menial tasks that they didn't like doing, things like sorting faxes, dealing with paperwork, being on the phone with the pharmacy. And so when we were able to switch to virtual assistants, we were able to improve the patient the practice experience for our employees. Other things that you'll want to consider is how can this improve the patient experience? And this is something that I'm really proud of for our clinic because we're able to be so much more responsive and get in contact with our patients much more quickly because of our virtual assistant support. We're also able to go that extra mile for our patients in many cases, calling around to pharmacies to help them find a medication, spending extra time to get a medication approved through the prior authorization process, helping them connect with a specialist. So it really has been able us to provide a higher level of care in our clinic. And then technology, you're certainly going to have a much more high-tech practice to be able to implement virtual assistants. So you're going to need to have an EHR that's cloud-based so that the virtual assistant can access that. You're going to need to have some sort of voice over internet phone so that your VA can access the phones virtually. You may need to have different communication tools because you're not going to be able to just walk by your virtual assistant's desk and give them some feedback. You're going to need to have ways to communicate with them virtually. Financial. So we did have that disclosure in the beginning that this is not legal or financial advice. I always like to say I'm not a lawyer and I'm not an accountant, But the basics on the financial, if you hire your virtual assistant through a company, they are likely going to handle this for you. If you're directly hiring the virtual assistant, the process is usually pretty straightforward on our end in the US. There's a specific form called W-8BEN, and that's a form that the VA would fill out and you would keep on file. And it basically says they're a foreign contractor and they don't live in the United States and they're not paying taxes in the United States. And ideally, your virtual assistant, if you're directly contracting with them, is sending you an invoice on a weekly or monthly basis and you're paying them as a contractor. But keep in mind, different countries could have different laws. So you may want to investigate or talk to your accountant about if there's any specific considerations for your virtual assistant wherever they are hired from. Security, of course, this is a really important issue. And this is important whether your virtual assistant is one of your in-person employees that sometimes works from home, or whether this is a virtual assistant on the other side of the world. And, of course, you're going to want to do HIPAA training just like you would for any employee. Even if your virtual assistant is hired through a third party, I would recommend that you make sure they are HIPAA trained as well on your end. So we still have our virtual assistants go through our regular HIPAA training process as well. You're going to want to make sure you have processes and procedures, employee handbooks that really clearly outline what security measures need to be followed. Of course, using things like password protection, making sure devices are protected. Are you providing their computer for them? Are they providing it themselves? What are you doing in terms of antivirus software, firewalls, VPN, those sorts of things? And really, it's essentially the same things that you are probably doing in your in-person clinic that you're going to need to do for this virtual assistant. You just need to make sure it's all happening. So again, the security thing is something that can be a little bit stressful for private practice owners. And so the AMA does have some additional tools that can help walk you through ideal practices for how to make sure not just your in-person clinic, but any remote or virtual employees you have are as well as yourself when you're working from home, are doing the best to protect security for your patients. So these are a couple of tools that the AMA has, including an implementing work from home program, a checklist for protecting computers, and of course, our private practice playbook. So a little bit about my story at Green Mountain Partners for Health. We were facing some challenges coming out of the pandemic. Wages have dramatically increased in the Denver area. They'd actually more than doubled since I had first started my clinic at that point 6 years prior. So it was a huge change in what we needed to pay for a medical assistant in our clinic. But like most of you, we really hadn't experienced a significant change in our reimbursements from insurance. We were also just having trouble finding long-term staff members. We were going through staff extremely quickly. A lot of our assistants had previously been pre-med students, which was a great way to mentor people and really had motivated, wonderful assistants. But even that was a struggle to recruit. And for all the different reasons, related to the pandemic, those employees were not staying as long as they had in the past. So we really were struggling. And we were also having increasing patient demands in primary care, at least. Patients have been engaging in a lot more contact with their healthcare providers since COVID. We, in our specialty of obesity medicine, had a lot more prior authorizations we were needing to do. And so, we were being pulled from a lot of different directions in terms of meeting the needs of our patients. So we got to a point where you'll see my little dumpster fire picture here. We had one medical assistant supporting our entire clinic for a week because of different transitions and bringing new people on board. And this really was the breaking point where something had to change. We needed to change our staffing and our workflow because that was, getting to a point where it was going to be, an unsafe way to be able to engage with our patients with just one support staff. So virtual assistants became a really wonderful solution for us. We hired two virtual assistants through a VA company, and we had them start with just basic tasks, managing our faxes, helping manage messages, managing our prior authorizations. By diverting our budget to virtual assistants, which were more affordable than the MAs and receptionists in our market, we were able to hire a more skilled office manager who took more capital. So we hired an office manager who had a stronger skill set, was a lot more reliable, but she did cost a lot more. We then hired two new medical assistants for in-person. They were recent MA grads. And again, because of the financial shift to having some virtual assistants, we were able to pay these new MAs more and offer more benefits, which allowed us to recruit better candidates and also retain them for longer. So at that point, we hired another virtual assistant, and then we started expanding what the VAs were doing, really passing off more and more tasks that could be handled virtually to them as we trusted them and developed them as members of our team. And then our most recent transition was to hire another virtual assistant to really do all of our billing and take some of that off of our office manager's plate, and also kind of freed up additional budget because that ended up being a more affordable option than the billing service we were currently using. So really allowed us to redistribute things, not just workload, but also financially how we were distributing income in our clinic. So the wins from this, we were able to offer more service to our patients. So we were able to be higher touch, really make sure our patients are getting everything they need in terms of prior authorizations, in terms of coordination with specialists, even sometimes helping people find medications with all the shortages that we've experienced in the last couple of years. We were able to dramatically improve our billing efficiency with an incredibly skilled virtual assistant who already had an expertise in billing. I was able to increase workflow in my clinic by having a office manager with a higher skill set. And I was able to pay my office manager and my in-person staff higher salaries, as well as give them better benefits. We improved job satisfaction because our in-person staff didn't feel like they were doing some of the more boring tasks that took them away from patient care that they enjoyed more. So I hope that was a great introduction into how virtual assistants might work in your clinic. And I look forward to engaging with you all more on our discussion board so that we can figure out how virtual assistants can work for your practice.
Thank you, Dr. Francavilla, for your time with us today. I'd like to encourage everyone to check out our discussion board where we'll have some weekly prompts going. And the first one is what tasks could be transitioned to virtual assistants that you may currently have in your practice. I'd like to also encourage you to check out the Steps Forward website for additional tools and resources. That concludes today's presentation. I hope everyone has a great day.